My name is Cordell. I am one of the nurse educator students. I'm here today to actually perform a lungs and thoracic exam. I'm here with Miss Jones. I'm getting consent as well. She volunteered. I'm also getting consent for doing the video and also making a YouTube link to share with my professor. Do you give consent?
Yes.
Okay, thank you. So what I'm going to do today is I'm actually going to do checking your cavity, looking at your lungs, examining your thoracic area, and ask you a couple of questions while I'm doing the exam. Okay? So what I'm going to do, as we always do, is inspect the area. It's easier done on a male for demonstration purposes, but in this case I don't have one, so I'm going to utilize my wonderful female volunteer. So you would inspect both the anterior and posterior of the back. So I'm just looking at the front and I'm looking at the back and I'm observing that her chest is moving asymmetrically. There's no increased work of breathing. Respiratory rate is within normal limits. There's no acute distress presently. Okay, and there's no lesions. There's no sign of trauma at this time. So then I'm going to actually slightly palpate the front and the back, and I'm going to actually just ask you to turn this way so that they'll be able to see. Thank you. And what I'll do is I would literally take my hand and I would come on this side so I'm not blocking the camera, and I would slightly palpate. And I'll palpate for crepitus, and I would slightly move my hands around, and I would slightly do the same here. Okay? And the reason why we look at that is just to make sure that there's like no trauma, bony crepitus, or if there was any like free air under the skin or escaping in the cavity. Okay, so I've palpated, and what I'm going to do now is actually auscultate. And when we auscultate, we actually want them to, every time I move my stethoscope, you take a deep breath in and out. Okay, so I'm going to start auscultating. Actually, like, okay, all right, and I'm just going to do here and here, and there you go. So I'm going to just
residents in room 1010, please. Residents in room 1010.
okay. So based on auscultation, her breath sounds are equal, clear bilaterally. Okay, I'm so sorry. And what I'm going to ask her to do is actually stand up, because what I'm going to do is actually put my hands and actually auscultate and then palpate her. So you look for the rib spaces, and I'm going to start to percuss. So once I start percussing, you want to make sure that you could hear, and in her case, her breast tissues here, so I would find the next intercostal space, which is present here. And then once you hear there's dullness, you know you over a bone or you actually over an organ. So I'm gonna do the same thing on this side, okay? And I'm percussing. And then I'll move this way until I find it. And then I know I'm hitting for dullness. And I'm gonna slightly turn it on this side so I can demonstrate. You cannot really do it on the scapula because it's gonna give you dullness, so you wanna be able to go press, okay, okay. Okay, then you hear actually where the dullness starts. What I'm gonna do is I'm gonna ask you, okay, can you say 99 for me?
99, 99, 99.
And what I'm trying to do is get the vibration from when she's saying it to actually feel the vibration in the intercostal space. I'm gonna turn you this way so I can do the same thing.
99, 99, 99, 99, 99, 99.
Okay, so you actually got to feel the vibration equal and bilaterally on both sides. Okay, what I'm gonna do is I'm gonna ask you to take a deep breath in and hold it for me. I'm gonna actually feel where I felt the dullness. Take a deep breath. Okay, and hold. Okay, so you could see the expansion of thoracic area, and relax. Good. You could see it moved with your hand. It's equal and it's symmetric, moving together as one. I'm gonna ask you to whisper 1, 2, 3 for me, and I'm just gonna actually put my hands to kind of hear it. Okay. Okay, and I'm now gonna actually ask you to do that while I listen. Okay. And with my stethoscope, I cannot hear her saying 1, 2, 3. If I heard her saying 1, 2, 3, which would be like a whisper test, and I hear 1, 2, 3, then there would be a concern that there was some consolidation in her lungs. Currently, that's not present. Okay. Thank you. And this is concluding our exam of the lungs and thoracic area. Thank you.